My name is Alfredo Castellanos, and my specialty is pulmonary critical care. I basically have two positions where one position is working in the intensive care department, working with very sick patients. And the second position that I have is I work with patients who have lung diseases. For example, COPD, pulmonary fibrosis, pulmonary hypertension, sleep apnea. My family, I come from a family of 10. The family struggled. They were working in agriculture. And my parents actually never even went to school. I think they went to school up to the 3rd grade. You know, growing up in that type of environment, I knew that I needed to kind of get out and go to college and do something with my life. And I went to UCI as an undergraduate. I think it was maybe 90% of the students there are pre-med. So I was like, let me just do pre-med. Everybody else is doing it. Let me take the pre-med classes. And then I started doing some volunteering in the local clinics and did some research at UCI. And I did clinical research trials with Novartis and other drug companies, working with Alzheimer's dementia patients and some schizophrenia patients. The research was fun, but it wasn't as fun as dealing with patients on a daily basis. And kind of doing that, I ended up applying to medical school, and I ended up going to medical school at Temple University in Philadelphia. That's kind of where I got exposed to the intensive care department. So I applied to an internal medicine program and I got into USC. And then I applied for pulmonary critical care fellowship, and I was able to do my fellowship there as well. I was offered from PIH Health to work in the outpatient pulmonary department, which would allow me to have more time with my son. He developed a brain tumor. He was only 11. They did surgery and removed it. We went home. He was in a wheelchair. He had double vision. He couldn't walk straight. He had to learn how to do it. He couldn't feed himself. And he had to do a whole year of chemotherapy. And my son now, he's in piano. He's doing taekwondo. He's doing golf. I definitely like the outdoors. My wife's a runner, so I also work out, but I do more weightlifting than running. My knees aren't the best. And I'm definitely a foodie. I started a pulmonary rehab because we didn't have one here. We were sending all our patients to different centers that were far away. I definitely enjoy what I do, providing the best compassionate care I can for each patient. And with the skills that I'm bringing to PIH Health, I'm able to provide advanced techniques to get better and quicker diagnosis of lung cancer. My ultimate vision is to have like a comprehensive lung center here at PIH Health, saving people's lives. And I definitely feel that they put patients first here.